Hey guys, Dr. Grenfell from Elite Spine and Sport. Today I wanted to chat with you briefly about low back pain, specifically mechanical low back pain that will respond favorably to specific exercises. So I'm trained in mechanical diagnosis and therapy through the McKinsey Institute, and a big thing that we often do in our office is try to find specific movements or exercises that make a change in your pain. Ideally, obviously, we want that to get better. So we're going to use a scenario today where someone has low back pain in the lumbar spine, and that pain is going to radiate in a sciatica type pattern down the buttock, the thigh, maybe down into the calf or the foot. But what we find is with certain exercises, in this case we'll use an extension motion, a backwards bending motion, that pain will centralize, meaning move out of the leg towards the spine, and abolish. It'll go away, and it's a really cool phenomenon. Now, this happens quite frequently, and usually what we call this is an internal disc derangement. But we get asked all the time, okay, that's really cool and it's awesome that it happened, but what is happening when I do those extension exercises, and why do I need to keep doing it? So I want to give you a little explanation as to what is going on with the disc itself when you're doing those exercises. So here's some fancy artwork I did for you. I hope you enjoy it. On this side, we have a normal lumbar spine. We have two vertebrae here. This is obviously just a section with an intervertebral disc in between. We're going to think of this disc like a thick jelly donut. It's got a lot of crust around it that's really structurally sound, and a jelly center that's kind of more like toothpaste, okay? And that's the nucleus of that disc. So here's a top view looking down on that disc. We've got that thick crust with the jelly in the center. And with normal movement, normal wear and tear, we have a nice healthy disc. Now we're going to take our scenario of our low back pain person, and that person sits at a desk all day at work and then comes home in the lazy boy, is lounging, goes to the gym, tries to do some exercises but doesn't understand how to maintain a neutral spine, and puts a lot of flexion, wear and tear on that. So now in this scenario we see in flexion, the front side of the spine approximates, the posterior or back side of the spine opens up a little bit, and that creates pressure pushing that nucleus of the disc backwards, okay? Now at the same time, through all of that flexion dominant movement and posturing, we also develop little cracks and fissures and normal wear and tear in that disc. That's normal, and it would repair, right? As we're sleeping, that disc is going to repair itself. But we spend so much time in flexion in our regular lives that we continue to do more damage faster than what we can repair, and so that damage accumulates, and now we end up with a pain cycle. So now what's happening is with that flexion, I'm pushing little parts of that nucleus, that jelly center of the donut, backwards into some of those cracks and fissures. If I do this long enough, I may actually push some of the nuclear material out to the outside of the disc and create a disc bulge or herniation, or even worse. But in this case, we're keeping it intact. But the outer part of that disc is innervated. There's little teeny tiny nerves that innervate that disc, and when that nuclear material comes in contact with those little tiny nerves, you're going to get a signal to your brain that there's pain. And the more nerves that I contact, the bigger that pain pattern can get. So an interesting fact here is that these little nerves jump on the same nerve highway as the sciatic nerve coming back to the brain. So now as I develop more and more what we call discogenic pain, pain from the disc, your brain might start to interpret that as pain in your butt, or pain in your thigh, pain in your calf, right? That radicular sciatica type pattern. So in this scenario, you don't have a pinched nerve, as some people will say, but that pain pattern is going to be just like that pinched nerve in that case. So now what we want to do is take this person, and I'll turn around, or stay this way, sorry, and we're going to extend them, assuming we got a response we want to see. And by extending them, we're going to close down the back side of the spine, and we're going to put pressure on that nuclear material to move back towards the center of the disc where it's supposed to be, moving away from the cracks and fissures and teeny tiny nerves, which is also going to hopefully allow that disc to heal up right. And when we do this, what we often see is that centralization phenomenon, where the pain, that referred pain, is no longer in the leg or the thigh or the butt or diffuse across the back, but it becomes very centralized to the spine and eventually goes away. And that phenomenon is kind of a hallmark sign of what we call an internal disc derangement. So these fibers are becoming deranged. It's not a herniation or a bulge necessarily, but it's also a damaged disc and an injured disc, and so you can get pain from that. So that is one of the explanations as to why someone with low back pain or radicular pain down the leg gets awesome relief, in this case from extension exercises. Now, not all back pain is going to respond to extension, but it is definitely the more dominant movement that we see, as in our culture and society we spend so much time in flexion-dominated positions. So if you have back pain, you can give some extension exercises a try. We have some on our YouTube channel and on our website. Give them a shot. But at the same time, also come on in for an evaluation and we can see what's going on. If you have other questions, please feel free to ask. We love taking the time to answer these questions, and hopefully that gives you a better understanding of what's going on when you're doing extension exercises and your pain is going away.